Hi, I'm Brittany Montez, and this is the Orlando Health News Review for May 5th. This week kicked off National Nurses Month, a time to thank and celebrate our more than 5,000 Orlando Health nurses. Nursing team members, check your email for weekly messages from your Chief Nursing Officer outlining the topics, events, and offerings created to recognize you. Be on the lookout for more information on this year's Healthcare Week activities. And if you haven't sent in your submission to next week's Nurses Month and Healthcare Week video, it's your last chance to take part. Check Swift for all the details. And on Friday, we concluded our team member giving campaign. Let's hear a few words from this year's campaign co-chairs.
Hi, I'm Kelly Nearstead.
And I'm Andrew Snyder. Thank you so much for participating in this year's Be All In campaign. It's been an amazing month.
Andrew, I've enjoyed so much working with you this month. We've heard some amazing stories from our team members about what it means to them to be all in. And it's not too late. If you'd like to continue to give, please feel free to go to our website to teammembergiving.com.
And thank you for all you do for Orlando Health every day. Our patients and our community really appreciates all of you.
Thank you.
And here are this week's prize winners. And if you celebrated 5, 10, 15, 20, 25 or more years of employment in 2020, you should have received an invitation by mail to attend the Service Awards Banquet on Friday, May 21st, 2021. This event, which was rescheduled from January, will take place at the Orlando World Center Marriott. See Swift for more details. And on April 21st, the Firestone Grand Prix of St. Petersburg made a stop at Bayfront Health St. Petersburg to greet team members before the Grand Prix weekend event. Team members were invited to see the race car up close, take photos, and enjoy complimentary cupcakes. And beginning May 9th, team members will no longer need to scan their fingerprints when clocking in at Kronos time clocks.
At Orlando Health, we have approximately 500 Kronos clocks for timekeeping, and many of the facilities at Orlando Health have the biometric finger scan capability. So if your routine is you come to the clock when you come to work in the morning and you punch, scan, fingerprint, you'll no longer have to do the fingerprint option. It will just be punch and badge. If you're a team member that your daily routine is you badge and finger scan, you'll only have to badge and not do the fingerprint scan. But there's several locations where the biometrics have not been enabled, and you'll just continue to do your daily routine. It's going to be more efficient, it'll be faster to clock in and out. It'll also reduce the number of missed punches and errors that the team members experience.
And the Orlando Health Foundry program is introducing a new wound irrigation tool designed to clean the most common types of open wounds called the IrriGator.
I thought of this probably over 10 years ago, but being a resident and then being an attending and the medical director, I never really had time to dedicate to the invention and researching patents and prototypes and all that. So the Foundry came along and somebody introduced me to it, and it was perfect. They kind of put everything that would have taken years and years into a quick 8-week process. We had consultants, we had biomedical engineers, and we had a prototype within about 6 weeks of starting the Foundry process. A laceration seems like something that shouldn't take very long. It's a simple process, but to gather all the materials, to have a tech or a nurse to help you irrigate a laceration, it can take a long time just for a simple procedure. So to have this, everything, it's already pre-filled. All you have to do is grab the IrriGator off the shelf and you can start taking care of your patient. We call all the patients 48 hours after that we've used the IrriGator. We haven't had any complaints, we haven't had any infections, we haven't had any unexpected return visits. We use the correct amount of saline that you're supposed to use to irrigate wounds, and it's at a consistent pressure that's been shown to decrease infection rates.
The IrriGator is currently being tested and evaluated in a clinical trial in the RMC and Orlando Health St. Cloud emergency departments before submission to the FDA later in 2021. And the National Database of Nursing Quality Indicators, or NDNQI RN survey, is taking place through May 23rd at all Orlando Health hospitals except for Bayfront Health St. Petersburg, which will take the survey at a later date. The NDNQI survey is available to eligible RNs who will receive an invitation to participate in the survey by email or letter. Well, that's it for today's edition of the Orlando Health News Review. See you next week.